And a good Sunday morning to you. I'm Andrea Oliver. Welcome to this edition of Polk County Today. It's a fact. We're doing more, we're doing it longer, and we want to do it healthy and sound. Might sound like a mammoth task. It certainly explains why we're looking for ways to work around the real issues of aging, stress on the body, even repetitive injuries. It's why, whether we're young'uns or seasoned citizens, we appreciate the work and advances that are constantly being made in the area of orthopedic surgery. And so excited today to have in studio with me Dr. Marc Volpe. He is a Watson Clinic physician, board certified in orthopedic surgery with a subspecialty certification in sports medicine. And I can't wait to get into that part right there. Dr. Volpe specializes in minimally invasive surgeries of the hand, wrist, shoulder, hip, knee, and ankle. That pretty much covers the whole body, kind of, sort of there, doctor. He was the first orthopedic surgeon in the area to be trained to perform MIS techniques for total and partial joint replacement surgery. And we are so excited to have you here in studio with us on this Sunday. We appreciate you being here. Dr. Volpe, I have to start by asking you, because you're in an area where you're seeing a lot of maybe more of the seasoned citizens and the young'uns. What has been the approach over the last several years in how you treat and cater to your patients?
Sure. Well, I just want to thank you, Andrea, for having me today. This is something new for me, and I appreciate the opportunity to, I guess, get the word out for these issues. In regards to treating the population who has some physical ailments but they want to continue to be very active, it can be a bit of a trick and a balancing act. A lot of what drives our society now is the aging of the baby boomers.
Yes. And
it's very common to consider terms like boomeritis or
I like that.
The itises that we all get as we age. It could be tendinitis, it could be arthritis, it could be bursitis. And these are things that do come with advancing in age and wanting to continue to be active. And that is something that's different in our society now compared to what it might have been 50 years ago.
As a matter of fact, 50 years ago, you get any of those itis, you feel like it's over. I'm going to go sit down and start knitting.
That's about it.
Quilt people, please don't send me any emails. But that's kind of sort of where we were. But now we're realizing we can still have an active lifestyle. And there are things we can do not only to preserve some of those joint muscular situations, but we can absolutely correct. There are corrective procedures that we can do as well.
That's true, yes. Yeah, since I've turned 50, I've actually been involved with the Senior Olympics.
He looks like he's in his 20s,
yo. Oh. I don't think so. I'm not sure if she can see the gray in my beard. But being involved in these activities, you see people who really are amazingly vital. We have people who are involved in running long distances in their 80s or even 90s, and it's inspiring to really go and watch this. So how do they accomplish that? Well, sometimes it's with help.
Yes.
Sometimes it's through great diet and exercise, and really trying to have a balance between overdoing it but maintaining a good regimen that keeps you fit, both from the standpoint of cardiovascular fitness, but also from muscle wasting.
Yes.
It's something that naturally occurs as we get older.
I think the word is we use is atrophy.
Yes,
I
atrophy.
don't like that word.
I don't like either of those terms. But it happens to all of us, and it's something that happens more rapidly if we don't stress the muscles and do the things that are going to allow them to rebuild stronger. The problem with doing these things is that it also stresses the joints.
Yes.
And joints, as opposed to muscles, don't respond well to overuse. They can oftentimes become inflamed as they wear out. These are the symptoms we see with arthritis. Patients very commonly will come in and tell me that they're having problems. They're not sure why. They've never had this problem. When I start to interview them and ask questions about their history, you'll oftentimes get that they've started a new exercise regimen. And as healthy as that seems, it's the culprit in a lot of their issues.
Dr. Marc Volpe is our guest today. He's board-certified orthopedic surgeon. We're going to make sure you have all his details and information on how to get a hold of him before we get out of here. It sounds counterproductive, doctor. It sounds really like a paradox, actually. You don't move, you don't eat well, you don't exercise, you're going to have some health issues. You do move, you do eat well, you do exercise, you're going to have some joint issues. How do you get that balance and help patients, help those you see to understand that there is a far greater benefit to keeping healthy and remaining active as opposed to the alternative?
So there are several points to be made there. One is that if you don't use it, you're going to lose it. Okay.
Yeah.
Very simply, if you aren't stressing the body, if you're not doing things that are aerobically going to help improve that aerobic system, you're not going to be as healthy in those ways. There's a balance.
Yes.
It is a very individualized situation because some people have had injuries in their youth. They may have torn an ACL while playing soccer. They may have banged up a shoulder, maybe dislocated a shoulder while playing football. If these things occur, there are going to be chinks in the armor that are going to prevent those people from necessarily doing the activities to keep themselves as busy. So you have to find alternative activities. Does
an injury mean that you're out of the game?
You may be out of certain games,
okay,
but not out of all games.
Explain.
So if I have a patient who comes in, they've had multiple surgeries on a knee, let's say, and that knee is fairly advanced in the amount of arthritis that they have. And to be clear, arthritis is where cartilage is lost. It's a wear and tear phenomenon usually, but it can be accelerated by trauma. And when that occurs, the body, when it experiences high impact activities, it will actually shed that cartilage even faster. So the process occurs where the cartilage is worn out quicker, the body reacts to the debris of wear or the wear debris, and we get symptomatic. If that's happening, a patient needs to recognize that they're doing too much.
Yes.
If
and the symptoms would be, other than I'm sure pain, are there other things you'll see that will tell you you're on the way to not being able to use this at all the way you want to use it?
Sure. One of the symptoms that tells you that we're talking about a knee, let's say, is not going to tolerate high impact activities is effusions or fluid on the knee. So if you oftentimes will get swelling in the knee, that's a big problem. That usually means it's on the way out. That's going to be a knee that's not going to tolerate playing soccer, not going to tolerate, jogging or things that you might have done for years. Mm-hmm. It may be smarter to consider lower impact activities like swimming. That's an excellent activity. It does not demand that you take the knee through a significant range of motion, and it's very low load. When we look at loading of joints, such as a weight-bearing joint like a knee, we look at jogging, for instance, and you hit the ground with about 5 to 7 times your body weight. Walking is 2 to 3.
Right.
When you bike, it might be 1 times body weight. If you're swimming, it's a half. So it's a significant difference in that peak force that you're going to hit that cartilage with and either have it shed or potentially keep it.
I know that over the years, as we mentioned, we've tried to keep people very active. And I don't know if where your area of practice is concerned, if it even, again, seems paradoxical, because we think surgeons thrive on surgery. That's what we believe. But there is a great move too in the whole sports medicine area and keeping people healthy and providing them with information such as you are today that can keep them fitter, stronger, longer. Do you have a place where you go to be able to find that balance, to be able to provide both care and provide it effectively?
So the majority of patients who see me are treated non-operatively. The indications for surgery are usually failed non-operative measures or conservative measures. One of the newer technologies that is present today is regenerative medicine, we term it, and that includes the stem cell therapy,
yes,
use of platelet-rich plasma, use of amniotic tissues. All of these technologies are geared toward helping healing, helping regeneration of tissues that have been broken down.
Who qualifies for this? Because I can imagine that there has to be a strict prerequisite or a strict, this patient would benefit from this, but this other patient over here would not. How do you determine?
So what you're describing is essentially a treatment algorithm. So what are the indications that we might consider using regenerative medicine? What are the indications that we might consider doing cortisone injections or doing physical therapy? And it all is a bit complicated, but in general, if someone has a very far advanced arthritic joint, and especially if that joint is deformed, so someone is very bow-legged, let's say, or very knock-kneed, and it's something that has progressed. They weren't necessarily born with it, or at least it's advanced. That situation is usually not amenable to much other than surgery because you have to correct those deformities. That's something mechanical that you can't do with just regenerating cartilage. If someone has not allowed it to advance that far, they're usually the candidates for these other conservative measures. There's a lot of excitement about regenerative medicine because it's another tool in our toolbox.
Yes. Is age a factor? In other words, I'm thinking, and maybe you can correct me here, that the younger, more active patient would probably be a qualified individual for this type of treatment. Is that some of the areas that you look at when you consider?
We consider age. We consider multiple factors, but age is not a limiting factor. The first patient that I ever had done a stem cell injection for was a patient who had hip arthritis, and it's been probably a little over 3 years. She came to me, was looking at getting a hip replacement. She had talked to some other practitioners, I believe in Sarasota, about stem cells, and we talked about it. I had told her that at that point I hadn't done one yet, but had been educating myself about it at different meetings and speaking to different experts in the field, and I thought that it was a viable option. Her arthritis had not caused any deformity. It was moderate to moderately severe, but not completely gone. And so she was a candidate, I felt. She wanted to try something other than doing a hip replacement, and it was a great success. Hips are a little harder than other joints because we have to do this either under x-ray guidance or under an ultrasound-guided injection, but we harvest the cells from her pelvis area. We put that in a centrifuge that spins it down. Mm-hmm. There's a machine within it called a cytometer that selects out these specific cells and concentrates them. We get that concentrated injectable, and then we inject it into the joint.
So let me remind our listeners, we're hearing from Dr. Marc Volpe today, board-certified orthopedic surgeon operating out of the Watson Clinic, and there are a couple of offices that we can share some information about. I know you're excited about the stem cell and being able to use that in advancing what you do. I have to ask you that as you look down the future, what do you see coming on stream that might also be beneficial and also be alternative to what we're able to offer now and offer to patients?
I think the most powerful technologies that are coming downstream are stem cells and gene therapy. And I think they'll be used in conjunction. They'll be harvesting stem cells. They'll be potentially modifying them with gene therapy, which will then guide them to differentiate into a different cell population and heal the specific defect or abnormality that we're trying to cure.
Dr. Marc Volpe, hardly enough time. So want to explore so many things in this topic area. But if you would, a quick number where we might reach you.
Sure. If someone wants to make an appointment, they can contact me or my office at 863-904-3099, or an alternate number is 863-680-0611. 7897.
And I want to remind our listeners that we do have those numbers here at the radio station. We'll be happy to pass it along. Thank you so much for the work you do, the wonderful work, the entire team at the Watson Clinic. I don't know where I personally would be without you guys. And I just want to thank you for coming up and being a part of our program today.